Welcome to Soteri Skin's episode about understanding itch and barrier repair. I'm thrilled to be joined by Dr. Daniel Butler, Harvard-trained dermatologist and the director of the Inflammatory and Aging Skin Research Program at the University of Arizona College of Medicine. Welcome, Dr. Daniel Butler. We're thrilled to have you. Thank you for joining us. And just to share with our viewers, Dr. Butler's research focuses on the science of aging skin, chronic itch, and barrier repair, three topics that are connected to what we do here at Soteri Skin. So today we're going to talk about how restoring the skin barrier can calm the itch and how that aligns with Soteri Skin's pH lock technology. So with that, Dr. Daniel Butler, every day we hear stories from our eczema community about how itch just takes over their life, keeps them up at night, and really just disrupts their daily routine. So from your research, what's actually happening beneath the surface that's making eczema itch so persistent? And why is it difficult to break that itch scratch cycle?
Yeah, well, Lama, thank you so much, and I'm always happy to talk skin science and why we itch. It's been a major conundrum for the scientific community for a really long time, and then for a larger population for the clinical community. I've been in dermatology now for about 15 years, and we've come a long way in understanding it, but I will say there's still a major need for a focus, both from a scientific standpoint and from a clinical standpoint for this population. And I think one of the reasons, unpacking your question, one of the reasons why this is such an indolent but torturing symptom is that you don't see much. We all itch, whatever it is, like every once in a while we're all going to itch, but it's really these patients who have chronic itch that are really, really miserable. And, certainly the eczema patients are part of that group. Um, and so when we start to look at it, when we look at the advances of where science has taken us in our understanding of this population, I like to simplify it really to three major categories. And each of these categories has subcategories. And just so everyone knows, how robust these subcategories are, I mean, people spend their careers in each one of these categories and each one of these subcategories. So the three categories that I like to talk about are the barrier, the immune system, and then the cutaneous nerves. So these three together, in some sort of interplay, are the cause of itch in many patients. And when you're talking about the eczema population, the main contributor the main two contributors, I would say, are the barrier dysfunction and the immune system. And I think those two ultimately contribute to some sort of aberrant nerve response that results in itching. But we see this Venn diagram of these three things coming together, and they have different interplays for different patients. And we even know that at different times of life, different contributors, so different parts of that Venn diagram of contributors may take order or may take lead in what's causing the really awful symptom. So, long story short, if we generalize it, we can look at the barrier, the immune system, and the cutaneous nerves, and each one of those are a main contributor in directing the others and leading to this really miserable symptom of itch.
So what actually damages the barrier? Like what is a damaged barrier for people who don't really like understand these technical terms?
Yeah. So a damaged barrier, or what causes a damaged barrier, is an easy answer. Basically everything. Our skin is essentially the walls of a castle, right? And so the walls are taking heat all the time. So they're taking temperature changes, they're taking wind, they're taking, for the metaphor's sake, or removing the metaphors, they're taking oxidative stress from all the pollutants and free radicals that are hitting our skin at all times. Hot showers, these things are coming at the castle walls all the time. And most of the time, the castle walls can stick up to it. But there are times when we are forced to recover. And what we know is that that recovery process is something that's really a miracle, that our skin can recover from, all these outside factors, the sun, the wind, pollutants, all these things, but our skin really can regenerate. And those are the things that from a day-to-day basis do cause barrier change. The other thing that I'll mention, just because you mentioned eczema patients, is some patients have structural problems with their barrier. So patients with eczema, and this is again an oversimplification, they have a decreased function of a structural protein called filaggrin. And this is again, this is high level. But if you think about it as the castle walls have some part of their root, their cement that's a little bit faulty, that's what you often see in eczema patients. And when that's the case, that means that your barrier is going to have a hard time just dealing with the day-to-day insults, let alone that recovery. So when I think about the barrier, I think about it in two ways. One is it can be faulty at baseline. That's just genetic predisposition. And then there's also the day-to-day insults or assaults that it gets from just our environment, from living life, and these are not things that are necessarily, you're deliberately putting yourself in harm's way. This is just waking up in the morning, your barrier is going to get slightly disrupted.
And why is filaggrin important for a healthy skin barrier?
Yeah, so a filaggrin, that structural protein, has a lot of different functions. But in my I'm not a basic scientist, but in my way of thinking about it, so one, it's like that cement. It provides that structure. And so if you don't have that structure, that's going to be one issue. The other part of filaggrin that I think is really interesting that we're starting to understand more about is that when it breaks down, it actually increases the acidity of the skin. And while that may sound a little bit scary to some of the people listening to this, breaking down to an acidic product is actually good for the skin.
Mm.
When we're at our most protected skin levels, our skin's actually a little bit acidic. And we see that as we age through time and as filaggrin loses its normal activity, we actually see less of that acidity and a more basic or a trend to a more basic pH, an increase in the pH of the skin. And that has its own issues. So filaggrin is both structural and it's important for maintaining the pH of the skin.
I'd love to hear what you think about skin pH and why that's important for a healthy skin barrier.
Yeah, so I mean, I think of skin pH as the great regulator. So I think of pH as a contributor to multiple different things. And if I'm going to use another analogy, I think of it as almost like the thermostat of the house.
Mm.
How do you make sure that everything is under good control? How do you make sure that the baby's room is the right temperature? How do you make sure that grandpa's not getting too upset because the house is too hot or too cold? This is a system that touches everything. And so the pH is number one, important for barrier function and some of the other contributors to the barrier. So something like lipid homeostasis, which is the lipid layer of the skin. pH is critical for appropriate maturation and processing of the lipid layer. That's the fat layer that essentially protects us from the outside. It's a really granular piece of the barrier. pH is essential for that normal lipid processing.
Mm.
The other thing that is really important for pH is that it regulates the microbiome. So
Mm.
we have a lot of buzz about microbiome, and we're still trying to understand the right ways that it contributes, or it either can affect in a good way or a bad way the barrier. But what we do know is that as the barrier or as the pH changes of the skin, the microbiome also changes. So as we exit that normal acidic pH of the skin, we start to see microbiome changes that allow more pathologic organisms in. And, that becomes its own problem when things like Staph aureus, which is a pretty common pathologic bacteria within the microbiome, can start to become resident on the skin, and it causes its own issues if there's a disrupted barrier. And it propagates a disrupted barrier.
Mm.
And then the last thing that pH does, and I know it does way more than this, but one of the ones that's come to my mind is is in its function as a maturation agent and as something that maintains the skin's ability to slough off or desquamate.
Mm.
So sometimes when the pH is off, you start to see abnormal sloughing or desquamation of the skin. So this is our normal shedding. Our skin usually takes about 14 days to shed day to day or week to week. And if you have abnormal pH, you start to see those normal activities become problematic. And so you may be either keeping skin for too long, avoiding that desquamation, or you may actually be desquamating too much. So it's really important that we maintain that optimal pH so that that regulation can be seen in all corners of the house, and each of the contributing pieces are in their happy state. So think about it as the thing that makes everything happy to function.
And then for those viewers who don't really understand what the skin microbiome is, just how would you describe that just in like layman terms?
Yeah, the skin microbiome is the bacteria that lives on all of our skin. That may sound odd or uncomfortable, but the funny thing is if you took all your bodily cells away, all the things that were native to you and me, and we took them all away, you would still be able to identify us because we have so much bacteria on our skin, in our gut, everywhere in our body that touches the outside environment. So this is what I call the beautiful homeostasis between the outside environment and our true personal cell lines. And so that microbiome is part of how we interact with the world. And what we're starting to understand about the microbiome is that as much as we think we influence it, it also influences us. And it influences us both at the local level. So the microbiome that's on my skin influences my skin, but we're also understanding that the microbiome, these bacteria that live on my skin and your skin, they also influence us throughout our body. They can change the immune profile, they can alter nerves. So they do all these unique little things, and we're still trying to understand how each one of those little bacteria or those family of bacteria has influence on our different systems.
So when the pH is imbalanced, it creates the perfect environment for the harmful bacteria to grow on the skin surface. And so when that happens, that imbalances the skin microbiome. Could we think of it that way?
Absolutely. Absolutely. So if uh, let's go back to the temperature regulation. If your thermostat is off in the house and it's horribly hot, all of a sudden you're going to see, the trash is going to start to stink, and grandpa's on the couch. He's going to be pissed off, and the baby's going to be crying. So all of a sudden you're seeing some of these abnormal responses when the normal homeostasis or the normal peacekeeping measures of the skin or of the house in the analogy are not kept.
Okay. And so when you have more harmful bacteria than good bacteria on the skin surface, that's when the immune system starts to react, right? Because, like, the immune system thinks, oh my God, something's attacking me. There's all this harmful bacteria. And so that's what manifests as redness, irritation, and itch.
Yeah, absolutely. The immune system is, we haven't talked about it as enough. It should be getting more mention, so that's my fault. But, the immune system is right along with the barrier, these structural proteins, the bacteria. They're almost one and the same. They all play together in the same sand pit and the same soup that we're talking about. And so when there is problems with the pH, the immune system is going to respond just to that, let alone the fact that there's also going to be changes in the microbiome, in those bacteria that normally live on your skin, but are now getting kicked out for more problematic pathologic bacteria. So you're giving the immune system an extra reason to come to the skin when you start to have pH problems that are leading to a cacophony of events, one of which would be microbiome disruption.
And so, treating itch, as a practitioner and a dermatologist, what's your how do you treat people that are itchy? Like, do you think of it as a combination? Do you think of combination therapies, or how do you think about treating people who are miserable itching?
Yeah, this is such a good question, and I'm glad because we get to come full circle here, which is we go back to those three circles of the Venn diagram. So we talked about the barrier, we talked about the immune system, and we talked about the cutaneous nerves. And so anytime we're treating itch, we want to try to figure out which one of those elements is the main or one of the contributors. And sometimes it's all three. So you can do things to alter the barrier. You can do things to alter the immune system. You can do things that alter the cutaneous nerves. And the fun thing about them is that altering the barrier actually has an effect on the immune system and the cutaneous nerve. Same thing with altering the immune system. It's going to improve the barrier and help with our nerve responses. And then, as you would imagine, same thing with controlling the nerves. And someone who has predominant nerve related itch, it's going to help with the barrier. It's also going to help regulate the immune system. So they all play together. But anytime I'm trying to treat patients with itch, that's my therapeutic vision and my schematic is okay, how can I help to repair the barrier? How can I help to control the immune system? How can I help to control this aberrant nerve response?
Generally, itch in older adults, how is that different from itch in younger adults that are suffering from eczema?
Yeah, well, I love that you brought up older adults because that's my favorite thing to talk about. My background with older adults is that I had four grandparents as I was growing up, and I saw that aging, isn't just something that we need to avoid all the time. It's something that we need to understand, and our understanding of aging and our appreciation of it has actually educated us in this itch space. So itch in older adults is very similar to itch in general, but we know that aging in and of itself is an influence on each one of those systems that we've been talking about. So aging impacts the barrier through a lot of those mechanisms that we talked about. There's a natural increase in the pH of the skin. There's a functional decrease in the structural proteins. We lose our ability to regenerate. So we lose our ability to recover from barrier damage as we age. Those are just some of the things that happen as we age. So that barrier is disrupted as we age. We also know that the aging immune system has a lot of nuances to it. So we have these pro-inflammatory states as we age, things like inflammaging, which is this low-level pro-inflammatory state that starts at about age 40 or 45 and starts to go up. That has a lot of basic science background to it, that some of our cells stop functioning appropriately, that we lose some of our naive immune cells. Long story short is as we get older, it's not just that our immune system declines, is that it just becomes a little bit less regulated. And so that immune overactivity as we age, or that aberrance of the immune system, can also contribute to itching as we age. And then very similar to the immune story is the nerve story, which is there's a lot of new work going into this, but long story short is that the nervous system also has this aberrance in its response, and we start losing density of nerve fibers in certain areas, and so you see this very similar aberrant response. So looking at it holistically, you're seeing each one of those pieces of the Venn diagram that are disrupted by normal aging. And when you're seeing all three of them disrupted, you're going to get itchy patients. And that's why it's so common to have older adults who are itchy.
How do you think about moisturizing, and why is that important, regardless of what other therapy you've prescribed to your patients?
Yeah, well, I will say this, my answer to this has changed recently with new data that's coming out. But, I think that the first one, which is the most tried and true, is we need to just make sure that our barrier is restored as much as possible and constantly, because remember, our barrier is under constant attack. So part of this story is that you need to make sure to get a really good moisturizer to help that castle stay maintained. And it's a constant battle. It's certainly not a one-time thing that you have to just put something on and then your skin is moisturized. That's sort of the starting point. So what moisturizers do when they're working at their best is that they help protect your barrier. They supplement what in most circumstances is a damaged barrier to help strengthen it and protect it from those outside insults. It lets it recover and gives you a foundation to prevent some of that aberrant nerve activity that often responds to a damaged barrier. So think about it. If we're using analogies again, think about it as the brick and the mortar. If the mortar between the bricks is starting to slide, you want to supplement that and bring it back together.
Mhm.
So that's sort of the easy answer. I'll say one more thing, which is kind of the new stuff, which is we're finding that barrier disruption is actually can actually contribute to systemic inflammation.
Mhm.
And so while I don't want to be an alarmist, I don't want to scare everybody to think like, oh, if you have dry skin or if you're itchy, all of a sudden you have systemic inflammation. What we do know is that the barrier is sort of the alarm system of, interacting with our environment. So if your barrier is disrupted and more of those outside things are getting into your skin and irritating you, then all of a sudden your whole body is going to have to respond. And so I think there's a story to be told there, but that's the other reason why I tell patients to make sure to moisturize. It's not just to maintain the castle, it's also to maintain what's inside the castle and keep it safe so that it's not consistently getting alarms that, hey, there's something coming in, hey, there's a problem, hey, there's an issue.
So there are so many moisturizers on the market. As an expert in itch and atopic dermatitis, what do you look for in a high quality moisturizer?
Yeah, it's such a good question. And, we end up getting this all the time because the market is very crowded and it's very confusing for the consumer. And my first piece to this is really practical, which is moisturizer is not a one-stop thing. You're going to need to use this for a long time. So you want to find something that you're going to really like putting on, or at least not hate putting on. And I think that's different for every person. There are some people who really want a luxurious experience with tons of fragrance and things like that. And I think that's fine for the right person. And then there's people who have actively inflamed skin who are going to need to be really active about protecting their skin. And that person's going to need a different treatment, frankly, or a different moisturizer. And so for that patient who has a history of eczema or irritation, I'm going to look much more granular for things that are balancing for the pH. That's going to be really important that we're not staying up in those higher pHs and that we're working to get that environment back under really good control. I'm also going to be looking for things that are a little bit thicker so that they stick on the skin and can have a little bit more of that occlusive nature to them. And then also for actively inflamed skin, I'm going to really recommend to avoid any fragrance. I know there's a lot of people who love using fragrances, and that's fine for the right people. But if you're actively inflamed, you want to make sure that you're maintaining the pH, you have something that's truly hydrating the skin and isn't too thin, and that's avoiding fragrance.
Dr. Daniel Butler, thank you so much for joining us today.
Of course, thanks for having me, and thanks for having me talk about the science of itch. It's an evolving field, and there'll probably be more to this in 2 months.